board chair, education board chair, Mark Mendiola on the show too at 7:12 Wednesday, June 9th. This is the link. And in the KUAF News Zoom room, of course, Sabrina Salas-Mantanani, who is, it's a new term that popped up during COVID. Maybe it was around before COVID, but it's definitely more common now. She is, what do they call it, Bree? Teleworking.
Teleworking, yeah.
She's teleworking out in Las Vegas, Nevada. So, I mean, she's taking care of a bunch of family stuff, but, you know, if you ever get a minute to take us cruising Las Vegas, Bree, I kind of would be down with that because I've been to Vegas a couple times, and all I remember is dry sinuses.
Yeah, it's super hot out here. It's like once you step outside, it's like stepping into a sauna. It's so hot. But yeah, I'll definitely a trip down to the Strip.
Right. 7:13. Our next segment, we're going to bring on Judi Won Pat of VARO, is brought to you by Jay Goodman. It's called The Greater GU'd, where we highlight people making a difference in the community. We do it every Wednesday right here on the link. So let's go ahead and get right into it. With we're joking during the break about what we have to call you as a former speaker, former senator, a doctor, right? But you're always going to be a principal, right? You're always going to be Jason's principal.
Oh yeah, she was the best. Ran a real tight ship up at FB Leon Girl Middle School, but everybody loved Mrs. Won Pat. Everybody respected her.
All right, and I don't want to know about the time Jason spent in the principal's office because
there were more than one occasion.
Okay, right on. 7:14. So, Speaker, we want to bring you on, of course, just to kind of touch base with VARO, as we've heard just a bunch of stuff over the last few days relative to this tragic murder of Virginia LaGuardia. We also heard from the murder suspect's ex-girlfriend, and then outside of that, there's just been a real slew of domestic violence cases that have come down. I mean, we've read everything in the last week from a suspect punching a 12-year-old kid in the face and assaulting a pregnant woman. There's been a couple pregnant women. Yeah, just anyway, Speaker, it's been crazy. So we wanted to get you on to kind of get the word out again and maybe catch up with you on what VARO has been dealing with now that we're, because we spoke to you during the pandemic and there were concerns about people being shut in with their abusers. Now that we're kind of back to normal, we just want to catch up and find out where VARO is at. So good morning.
Morning, and thank you so much for the opportunity, especially to get the word out to everyone about VARO and of course our services. As much as we participate on any type of awareness program, you'd be really surprised that there are still so many who don't even know what we offer. Important thing I think that's important to know is that we are a 24/7 crisis intervention for victims and survivors of domestic violence, sexual assault, abuse, rape, and any other violent crimes, or a traumatic event that may have happened to them. And it's not just women in particular and children, but there are males as well. There are senior citizens also who, are victims. What a lot of people don't realize is that many times the violence actually, are from individuals that they know, and they're intimate partners, like you said earlier with this, recent victim. So people think that it's only others outside, but it's actually many times in the home. And when we spoke the last time, you're right, it was very difficult during the lockdown because many of them could not reach out to us. We do, to let everyone know, is that we do provide, emotional support and advocacy for the victims and survivors. We make referrals to resources that are available to us within the government, whether they're government agencies or nonprofit organizations. We accompany them to, like, for example, to GPD. They need us to be with them, or to the court. We provide some meals, shelter, transportation, and even emergency personal care kits, because they may have to leave immediately and not have packed So those are some of the services that we provide. And we are only a small organization, really, of three, a staff of three. But the biggest help comes from the community as volunteers to man the hotline, so that then we'll be able to, so they'll be able to reach us. If you like, I can give you some of the data.
Yeah.
On, like, for example, April 2020, which, of course, it was during the lockdown through March of this year, 2021, our primary victim and survivors, the number is really high, is 304. 33 are males, 249 are females. We had sheltered 53 families. Domestic violence and family violence, our numbers went up to 240. Sexual assault was 139, and child abuse was 57. So those numbers are definitely, high.
An increase, speaker, from maybe the previous year?
Yes.
How much of an increase?
Oh, I don't have those numbers, but yeah, at least in the report that was given to us when we had our last board meeting, that there's definitely these numbers are higher.
Why do you think that is?
Well, when we spoke the last time, it's because many times, well, first of all, they are on lockdown. Many families, we know that what has affected them, of course, is the loss of jobs. And and many times that is an issue. Economics is, an issue. And normally, too, you'll find is that on a regular day or year, what have you, is that many times the abuser would leave the home to go to work. And then when they come back, then, sometimes it would happen in the evenings or weekends or wee hours of the morning. But in this case, during lockdown, they're with them 24/7 as well. And I'm sure everybody has seen that. You get every little thing that bothers you, you take it out on somebody else.
Right.
And normally it would be, a partner, and sometimes, of course, the children.
Well, there was a comment here, speaker. Does the police department give your agency the names of victims? Do you reach out to them first, or are they responsible to contact your office?
Well, no, because what we do is that what we provide is a lot of information. So we have this a list of numbers and places to call, and usually, you're right. The first thing we would ask is that, first thing we ask is that, are they safe? But that's the most important thing. Then the second thing would be to ask them if they have reported this to, the police. And in many times they'll say no. We try to assist them. We say, I will give them the numbers to call, depending where they're at, where they're and where they're closest to. So we give them the Hagatniam, Agad, Dedidu, Tuman, and we even give them the DART number, which is within, of course, GPD, the Domestic Assault Response Team. We give them their numbers, and and then there are times, especially if it's like a rape, victim, they would ask us to accompany them to the police, or of course to the rape crisis center. For the most part, and if I know, I had one case one weekend where they did, that made several calls, and I was assisting and I was making calls myself, and I was able to reach somebody else and then connected the police with the victim. But most definitely, the police would definitely be one of the very first person to call. Because we take the calls during the weekends, then we would have to wait until Monday, where we give our data to the staff, and then from there on, they would then provide the rest of the assistance by making referrals as well to for legal assistance. So whether it's the AG's office, the Guam Legal Office, Public Defender's Office, the Victim Services Center, and one new one that we added on was the Micronation Resource Center. So we do that during the working weeks, of course, and government hours. But other than that, normally the very first over the weekend will be the police. But our staff they would take the call during the weekdays, and our volunteers would take it on the weekends.
Speaker, we had Beauty Camacho on our show yesterday, and this whole entire issue with Mr. Bass, who was arrested for murder of Virginia Laguatnia. She, speaking from her own experience, she was saying, there's something wrong with the system. The system is flawed. You work with these victims. What is your response to that, and what is your assessment?
Well, I definitely felt, that I felt her when she was talking, because, I had, like I was just mentioning earlier, I had a victim that I was assisting over the weekend, and she was having some difficulty too, and that's the reason why I would make some phone calls myself. It's not something that we normally do, but I felt for her. I feared for her safety. And that's why, I would continue to call, as and frequently. And you're right. And sometimes, and that was my frustration, is that, is there someone then not at the desk, because they weren't picking up, the phone, or were they all out, on the field? I don't know. But I know that there are cases, like I said, where the response was quick, and other times they're not. I know I tried leaving messages on their numbers, like the DART numbers that we have, and sometimes, of course, the numbers again we found later on that they're not working numbers, and then we always tell them there's the emergency number, the 911 to call as well. So, but there's definitely room for improvement in all of the list of places that we would make a referral to. But I also understand is that many of these places are nonprofit organizations, so they're not a 24/7 provider like we are. But most definitely the first line of defense will be the police, and that's where they need to beef up maybe the number of individuals that are a part of DART, because after all, we other providers as well, nonprofit organizations have provided funding to them to attend conferences, to always keep them abreast. We even provide some funding for for services and for staff. So, and if that is the case, then there needs to be definitely an increase or a beefing up of their either personnel or hours, especially because a lot of times we find that the hours really are more after working hours and late evenings. That's why we're 24/7, because we get phone calls even at midnight, 3 in the morning, and we stay on the phone with them sometimes too, because they just feel safe talking to somebody. So it's not an 8 to 5 time basically where they really need to increase, services, but to try to increase the numbers after the working hours.
Right. It kind of seems like the only number that works around here is 911.
How do you end, this cycle of abuse? You mentioned the police officers. We all know that they're short-staffed. They're leaving left and right, going to higher paying careers, going to work for the military. So it just don't know.
That's true, because we ask ourselves this question, and that's the reason why we do a lot of awareness. We go into the schools to speak to the children, because many times the children, we're told that, you don't share this, you don't talk to anyone, you keep this, in the family. So they withhold, that kind of information. So what we do is when we talk to the school children, we tell them that this is not right, that they don't deserve to be sexually assaulted or physically abused, even verbally abused. And it's amazing that the knowledge, when you tell these to the children, because I know as a former school principal, when we did the good touch, bad touch one time with all of our children, before we knew it, children now were coming into the office and the counselors and now are reporting these cases. So we did see an increase after, this awareness, programs. And that's why all these different nonprofit organizations are always having these awareness programs. The waves that you see out there is to let people know that we're here, and we provide these services, and we want them to know that what's happening to them, that they shouldn't take it, and there are other people that can help them. So it's got to start. I've always been a believer in education that sometimes it takes a whole generation to really weed out a lot of that, type of a behavior to be able to change it. But you got to start always, with the school children, so that then they become more aware.
We have a
no, I the magistrate's complaints, and it does. It's the victims, the children that are coming forward and talking with the school administrators and reporting the crimes. So, obviously you guys are making a dent in terms of spreading awareness.
Right. I wanted to just, there's a couple comments here. Glenn comments, and victims don't even feel safe. Sometimes victims seek help, and it's not even answered by GPD. An emergency protocol should be implemented so the victims can immediately seek assistance. You know what I was thinking about while you're talking, Speaker, is for these domestic violence victims of any type of crime, when they do their part and they go through the system and they get, for example, like a restraining order. I mean, I've heard so many times, even just in the last week, from just family members and then from also Beauty Camacho, when you get these restraining orders and then the people who are supposed to not come into contact with these victims are violating the restraining orders. A lot of time when they call the courts or whatever to report it, the turnaround is, we're talking hours response, right?
Yes.
And then also, conversely, on the flip side, you also read some of these stories where they're arresting people for crimes that they're committing against individuals that they already have a restraining order in place for. So can we is that a court issue? It's really annoying to hear these women come on and talk about how they're doing what they're supposed to do. They're calling the people who are supposed to be protecting them and just getting nothing.
They're all really trying. They are serving for a purpose. And like Sabrina said, is that many times it's the lack of personnel that, in that particular agency that, we're reaching out to. It's amazing because even though what we do, which is, to be an advocate for them and to make referrals and to accompany them and all that, but then when we take them to those specific agencies that they need the assistance, then they too are stretched. And, we can only do, of course, so much unless either one, they increase the number of individuals that they have. And that's the reason why all of us write for grants so that we can provide, more assistance to these individuals. But because we're a nonprofit, we're limited. So we rely on two main departments and agencies. The police, of course, for protection of these individuals, and the legal system to further then take them away from the victim, by providing restraining orders. Because that's one of the things that we do is we accompany them, or we provide transportation for them. So we can take them to the agency, but then that's the farthest we could go. And it is frustrating for us too, because then we later on we get the same calls from the victims, and we say, wait a minute, we just walked you through all this, and then and then now you're back, and so there is this, they fell through, the cracks. So we can't do anything beyond that, and it's frustrating for us as well.
Mm-hmm. Speaker, you've seen this from different perspectives as a former multi-term senator and former speaker, you're a former educator. Now you're here at VARO. Do you think that this just, that we need to prioritize the issues, these sorts of issues, family violence, sexual assault? Do you think it's not a priority, or it hasn't been a priority?
That's the $1 million question, of course. Health, public, education, and safety. But what we're finding is that there are very serious social issues actually happening, not just here, but throughout the world. And it doesn't even help, of course, when we see it, on social media. And it's what we actually then, teach. And that's why when I was a school principal, there was this program that I started, which was the advisee program, where a small number of students would work with an adult, and we talk about social emotional issues. Now, what we're and I'm so glad to see that that is now a requirement of these federal dollars that all of the schools are getting because of the pandemic, and being locked, down, and we're seeing a lot of social emotional issues. But we got to expand that now beyond just, of course, what was happening, being, on lockdown and not seeing their friends, and coming back. How has that affected them socially? How has that affected them emotionally? But we need to take it even beyond that now to such, to issues such as this. Have they seen violence maybe in the home and they've been traumatized, by this? Do they, because they spent a lot of time now using technology at home, that they've been surfing, the internet to find, movies and things to watch. And then a lot of it, many of it, even finding children's programs, you see some violence with these cartoons. And I'm saying, what is really going on? We say, yes, this is good to watch. And then what do we see? We see them fighting, competing, to see who's the stronger, person than the other. So in a sense, I like to always see see it this way, that when there are this real bad situation, and we want to turn it around now and take it and use it to our advantage, so that we can then now bring more awareness. We can walk the children through this, and help them, because that's going to be a major social issue that we will not be able to see. We'll see some numbers now, but I can't honestly predict what is it going to be 5 years from now, 10 years from now, as a result of that, because little do a lot of people know, but you ask many social workers, psychologists, people in that field, that as a result of what they just went through, there is this thing that we all are aware of, PTSD. We never realized it. Now they're seeing that even our, here we're coming up with liberation, but even our parents, our aunts and uncles who went through the war, there is PTSD, not just with those individuals who went through the war, but they're now finding that even the unborn child also has been affected. Because there's a case I was just reading, and I know that the individual who went through it as a child, when she herself gave birth, her son was going through PTSD and was diagnosed, of course, as a result of what his mother went through, and, is receiving psychological services. So that's what I'm saying. Because of what's going on now, we're going to see more of this, and I really hope that we continue to have more social workers, guidance counselors in the schools, but more importantly, I think too, aside from those individuals, which many of us are planning to do now, is to have a lot of training for everyone in our school campus who will be quick and ready to respond to this, at least initially, to recognize it, and then make proper referrals for these children.
Well, we thank you.
Task, I'm telling you.
Thank you. for joining us on the show. And real quickly, if you could just, if anybody is out there listening and need the services of VARO, if you could just provide that emergency hotline number.
Yes, please. The number is 477-5552, and it's a 24/7 hotline service.
All right. Thank you, Speaker Judi Won Pat, or
Thank you.
victims advocates reaching out.
Again,
Take care.
that number is 477-555.